I'm doing chronic heart failure, and chronic heart failure is defined as the inability of the heart to provide sufficient blood to meet the O2's need of the tissues and the organs. It can either be a deficit in the ventricle filling or the ventricle ejection. Heart failure is associated with other cardiovascular diseases, such as long-standing hypertension, coronary artery disease, and myocardial infarction. It's most common in people who are 65 years old or older, African Americans, people who are overweight, and people who have had heart attack. Men also have a higher rate of heart failure than women. In the scholarly article, Management of Chronic Heart Failure of the Older Adults, they wrote that chronic heart failure is the leading cause of hospitalization for those over the age of 65 and represents a significant clinical and economic burden. About half of hospital readmissions are related to comorbidities, polypharmacy, and disabilities associated with CHF. Two types of CHF are left-sided and right-sided heart failure. Left-sided is the most common form of heart disease. It is the inability to empty adequately and the inability to filter adequately during dystole. Right-sided heart failure is most common with people who have left-sided heart failure. So if you have left-sided heart failure, you're most likely to have right-sided heart failure. Some side effects of CHF are fatigue, dyspnea, tachycardia, edema, nocturia, skin changes, behavioral changes, chest pain, and weight changes. Complications that come with CHF are hepatomegaly, renal failure, and pleural effusion. Pleural effusion is the most common complication, which is the excess fluid in the pleural cavity. Diagnostic studies, signs and symptoms by the patient is not always reliable, so an echocardiogram is the main source of diagnosis with the ejection fracture. So the normal ejection fracture is 55 to 65%, and a person with heart failure's ejection fraction is usually 45% or less. Some drug therapies used to treat CHF are diuretics, which is used to decrease sodium reabsorption and used to decrease edema, which is a side effect of CHF. Vasodilators, which reduces circulatory blood volume. Morphine, which reduces preload and afterload. Nutritional therapy is also recommended for those who have CHF. So diet, teaching, and nutritional therapy is most important in controlling heart failure. So a nursing diagnosis that I found for CHF is impaired gas exchange related to an increased preload and alveolar capillary membrane changes, because shortness of breath is one of the main side effects with CHF. So an appropriate referral when indicated, would be to a cardiologist and a dietitian. I've had two patients who have had CHF, one who had acute CHF, and she had past medical history of angioedema, hypertension, cardiac disorder, and impaired gas exchange. She was on two medications, furosemide and losartan, to help with her CHF. Her vital signs were normal. She had thready pulses in her lower extremities, but she also had local edema in her ankles as well. I had another patient with CHF who came in with a complaint of shortness of breath, but she was unaware as to why she was experiencing shortness of breath, and finding out more about her, it was her chronic heart failure exacerbating and showing signs and symptoms again. So she also was alert and oriented ×4. Her vital signs were normal. It was just the shortness of breath that she had a complaint of. So some patient education that is important to give to those who have CHF is be active, limit your alcohol, quit smoking, lose weight, limit your salt intake to reduce the edema effect, call the doctor if you do gain weight, and call the doctor if you have any changes in symptoms. And it's also very important that you instruct the patient to take their medications even if they're feeling well. Some other information that I found was that approximately 25% of patients discharged with CHF are readmitted within 30 days. So basically teach the patient about the changes, the side effects, and keeping good exercise and maintaining their weight, low sodium diet. I think CHF is really interesting and fun to learn about.